So back in the early part of the decade, we had a tremendous issue with pill mills, a lot of these prescription opiates, which with some regulation and some state legislature changes, we were able to address that issue. What we're seeing now is really more of these synthetic street drugs. So these are patients that are buying heroin from dealers. A lot of these drugs are contaminated with other synthetic drugs like fentanyl and mixed in with the batch of drugs they're using. And these are potent drugs that are not typically used on the street. These are synthetic drugs that are pharmaceutical grade, sometimes up to 100 times more potent than your typical heroin you would buy on the street. So we are seeing a significant increase in not only use but mortality. So these patients are using drugs that are very potent, and many of these patients are dying. Typically in the emergency department, when we see patients that have opiate dependence issues, it's usually in an overdose or reach out type of situation. So these are patients that typically are either using IV heroin or oral opiates and unintentionally overdose, stop breathing, and are brought in by EMS or fire rescue for treatment. I think the worst part about the opiate addiction is that most of these people, if they had a choice and they had the resources, would rather get off of these drugs. But unfortunately, as a society, and it's not just unique to South Florida, but as a country, we haven't put a lot of that infrastructure in place to help these people get off of these drugs. But the saddest part is that most of these people, when they're sober, when you have a conversation with them, would really rather be off of these drugs. But because of the physical, emotional, and psychological addiction, it's very difficult for these people to get clean. Yeah, so this is a problem that affects everybody, not just the homeless population or the people living on the street, but doctors, lawyers, housewives. It affects everybody. Everybody has a friend or a family member that has been affected by this.